Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story?
Story 1. I'm a pharmacist. One evening shift I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. Man, I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes, he said it just like that. Me. Okay, I'm assuming there was an accident or it was unprotected. How long ago did it happen? Man. Last night, at 7 p.m. on the couch. Whoa, TMI, I just need to know approximate time to know if Plan B will work. Me. We have this medication called Plan B, and since the incident happened within 72 hours. Man. Oh yes, I got that for her already yesterday right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me. Unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period, and if she doesn't then she can do a pregnancy test then. Theoretically you could do a blood test for faster results, but that would also not be until a couple of weeks, at least. Man. We're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin, minerals, food? Me. She's already taken it, which was the Plan B. There are some other options but those are prescriptions. And no, there are no over-the-counter products she can take. Man. What about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? Me. No sir. There isn't anything you can take now.
Story 2. 73 here, former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge, then. I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back, patient provided improper specimen. Story 3.
Not a personal experience, but one from a colleague of mine. I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned, he recovers, every care and meds that he needs to take are prescribed, explained in medical appointments with a cardiologist, arrhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answered any calls from the hospital to know of him and reschedule. This went on for around 3 years. Until he shows up without a former warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talked to him and managed a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker, that should have been kept inside his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it with the pacemaker lead still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be or how he didn't die of sepsis or any other health problem that may appear for that matter. TLDR, man gets a pacemaker. Doesn't show up to appointments. 3 years later comes to the hospital looking for help, wearing his daughter's bra for 3 months, to serve as a holder for the pacemaker that got out of his body from his infected open wound.
If you enjoy this video so far, please consider subscribing for more content. Your support is appreciated. Story 4. Working midnight in the ER, family brings in a 4-year-old at 2 a.m.-ish. I ask them what is wrong. Them, ask him, the 4-year-old, he said he needed to see a doctor. Me, did he say anything was wrong? Them, no, he said he needed to see a doctor, so they brought him. A quick back and forth that firmly establishes that they actually showed up in the ER at 2 a.m. purely because the 4-year-old said he needed to see a doctor and they don't know why. Me to child. Why do you need to see a doctor? Kid, the doctor has suckers. Me, shocked. To be clear, it is the parents who lack sense and not the kid. Story 5.
I am a dermatologist in India. As is the culture here, people eat with their hands, and almost all of our curries or even other dry side dishes have a lot of turmeric. It is common knowledge to anyone born and brought up in India, that this means the nails of your dominant hand, statistically the right hand, are going to be yellow stained, because we have seen this happen since our childhood. Usually this wears off in about a day and a half if you wash it a couple of times. Cut to the first patient in my OPD, a young girl in her early 20s, very anxious. Me, what brings you here today? Patient. Doc, my right hand fingernails keep getting yellow discolored. Me, only right hand. Patient. Yes, and only after meals. Me, do you eat with your hands? Patient. Yes, always. Me, so, you know it's just turmeric, right? Patient. Yes, but can you make it stop happening? Me, for God's sake, use a spoon. Patient. So you mean there is no medicine to make it stop? Me, silent. Patient, silent. Me, no, this might hit home more with people of South Asian cultures or people who habitually eat turmeric cooked food with their hands. Anyway, for a grown person to complain of this was just well surprising and a little ridiculous.
Story 6. Physiotherapist. For those that don't know, after a total knee replacement, you basically have a 6-week window after the surgery to regain the range of motion. If you don't regain the range in those first 6 weeks, it ain't coming back. Had a patient who was a farmer, who was very enthusiastic about regaining the range because he needed to be mobile for his work. Saw him the first time about 5 days after surgery, showed him all the basic exercises, told him to not do any farm work for at least 6 weeks, and told him to come back to see me once a week for the first 6 weeks. He disappeared and came back about 8 weeks later. His range was non-existent, maybe 30 degrees of range in total. He was visibly mad at me, as if it was my fault, actually shouting and calling me incompetent. Our conversation went something like this. Have you been doing the exercises? No. How often are you doing farm work? Every day. Why haven't you come back since the first appointment 8 weeks ago? Too busy with farm work. So to summarize here, you did absolutely nothing that I told you to, and this is somehow my fault? Never saw him again. Story 7. I'm in the ER, so many stories. The one that left me dumbfounded was a woman who was brought in by her sister for pelvic cramps and amenorrhea for 3 months. Lo and behold, she's pregnant. My sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause, and her sister staring at the ceiling, I told her, no, because they speak Portuguese in Brazil. The patient seemed relieved and the sister hustled her out of the ER before I could discharge her. Story 8. Lady brings her baby into the ER with a rectal temp of 103. Kid's tacky as hell and looks horrible. Refuses all medications. Says she doesn't believe in them and wonders why her herbal tea, she brought a jug of it, isn't working. Wants us to just check her out. Thinks a children's emergency room just checks them out. Try to explain why the kid needs an NSAID. Keeps refusing. Says she doesn't know what's in it. I bring up that fact she had her kid in a hospital, and that she recovered medication herself, IV, epidural, etc., doesn't budge. Only concerned for herself, told her that when the kid has a seizure or goes unresponsive and you call 911, you can expect the medics to give the kid everything it needs regardless of whether you like it or not. Only when the doc threatened to contact social services for child endangerment and abuse did she start to listen. For like 5 whole seconds. Left against medical advice. People like this exist and breed. Thank you for watching until the end. Please consider supporting the channel by liking the video and subscribing. Until next time.